Welcome to our Inclusive Education Task Team webinar on disability and inclusion. Thank you all so much for joining us today and being willing to spend a bit of your day thinking about and learning about disability inclusion. Charlotte, if you could go to the next slide. So just a bit of webinar housekeeping. Your participant audio and video are disabled due to the large number of people who we have on the call. Please feel free to post any questions you have through the Q&A function at any time. We will do our best to address those in person during the webinar, and if we cannot, we will address them afterwards. The session is being recorded. Closed captioning is available in English, and you will find that button on the bottom right hand of your screen. And the recording, as well as the presentations, will be shared on the INEE website, as well as emailed directly to you once we complete the webinar. Again, thank you all so much for being here. My name is Yasmina Haddad, and I am a co-convener of the Inclusive Education Task Team and the host of today's webinar. My co-conveners, Charlotte Bourquin and Benjamin Bach, and I are so excited to have this opportunity to showcase the amazing work of our task team members and this opportunity to engage in this important conversation. Today's webinar will be in two parts. First, we will hear from our three panelists about the work that they're doing, and then we will engage in a roundtable discussion guided by some pre-written questions. As always, please feel free to put your questions in the Q&A and any comments you might have in the chat box. And as we're getting started here, please feel free to introduce yourself in the chat box. We love to know who's with us today and where you're calling in from. So to start us off, we are going to meet Sandrine Bohan-Jacot, and Sandrine will give us a presentation about her work with humanity and inclusion. Sandrine has an academic background in education and 20 years professional experience. She has held various positions in teaching, inclusive education, project management, and consultancy in the Middle East, Central Asia, and Africa for various NGOs, donors, and international agencies. She is currently working with Humanity and Inclusion as an inclusive education policy officer, and her role is to support programs technically with a focus on emergencies, advocate for the education of children with disabilities via international networks, and develop humanity and inclusion's expertise and partnerships. So Sandrine, you can take it away.
Thank you very much, Yasmina. Make me feel very old. I need to change it. Thank you very much all for being here. So very humbly, I'll try to share a little bit of what Humanity and Inclusion has been doing as a response during the pandemic. Next slide, please. Thank you. So maybe just a little bit of a note beforehand to remind, not all of you maybe are familiar with disabilities. So there are some specific issues for a person with disability linked to COVID-19. One of them was the potential health precondition that would make them more sensible to this virus. And there's other issues for them during the pandemic, one being the specific needs, for example, to touch things if they are blind or because they need assistance, for example, and also the lack of information, huge lack of information, because this information was not accessible, among others. So just to understand a bit of the context. Next slide, please. We also had a few concerns for children when the crisis started, because we already estimate that 90% of children with disability were out of school before the crisis. And we immediately realized that during the crisis, they would not be able to benefit from all the services that were going to be available, either feeding, health, or mental health programs, because most of them are given through school. They're also more at risk of dropping out and being a victim of violence. This was true for all children. It was even more true for them. Also, immediately we worried about the learning continuity, because a lot of the information and access to technology was actually not accessible. So a lot of countries responded with radio, for example, but of course, if you have a deaf children, it doesn't work. And also many government did effort with some learning platforms, but not all the platforms were accessible for children with disability. We were also worried that they were going to be overlooked by the mainstream education response from the government and the humanitarian actors. So we don't have all the answers to this, but on the next slide, and you have the link to this study. There was a nice study done by Save the Children on the hidden impact of COVID-19 on children and families with disability, and some of the results confirm what we would fear. So, for example, that one in three parents and caregivers of children with disability reported that their child did not have access to any learning material. Also, that 4 in 10 of those parents and carers felt unable to support their children with disabilities. So also that they were lacking material for homeschooling. So a lot of our fears were unfortunately confirmed. Next slide, please. So what we try to do with the child, in some area, we really had no technology because very little internet access. So we use what we had. So we had some, for example, in Kenya, some classroom assistant that we used to go to the family and support with the home learning. So they were supported by the teacher in doing this, and they also collaborated with the community outreach worker to try to assess what were the needs of children. So that was just a way to keep in touch. So we had no technology, but we did answer there. Next slide. When we had a little bit of technology, so just regular, nothing specialized. So in Middle East, like Lebanon and Gaza, we've been using, like many people, some free websites that are available on internet for children with disability, with activity, or some platform like we're using today to support some training for the teacher or for the parents and the students. Also some channel. That was a nice work from Gaza. Our team over there created some interactive and fun lesson that they uploaded on the YouTube channel. Or the use when people had smartphone of a free application like WhatsApp, for example, to have some support group for children who needed some support. Yeah, and also the phone to keep in touch with the children. Next slide, please. Just maybe a mention, even though there were this technical response, we still needed to print some material for children in most of the situations. So we also had the opportunity to develop some more multi-sectoral strategies. So I was mentioning the lack of information earlier. So for example, also in Middle East, we've been working on an accessible version of a storybook that you probably all know, which was called My Hero Is You. So we thought it was really a nice book and we wanted it to be accessible for children with disabilities. So we have created this version with the video showing the illustration, but also with audio narration and a subtrack that describing the illustration. It's in Arabic sign language and there were some closed captions as well. This is all available on the website. You have the link in the presentation as well. Next slide, please. So when we had more opportunity, I was excited to get some funds for Kenya to work in the camps of Kakuma and Dadaab, and we have been partnering with a nice organization called Ikitabu. So together we've been providing some regular and specialized material, so some brailler, some specialized, but just also very regular computer tablets. And especially tablets, because we have resource center over there, I should mention. So those tablets were fitted with some accessible package. So there were all the curriculum on it, but also some additional interactive activities. It works offline. So it's been really useful. And what is really nice is that Ikitabu has been working previously on the digitalization of all the curriculum. So not all the grades yet, but we're working on this, and they also help us to train children to participate to some digital platforms. So it's been really nice, and we've been doing this together with the authorities So this is for me a really nice example of the nexus. I have 30 seconds left, so I'll go to the next slide. So yeah, there's still some things to do. I think we all are suffering some budget cuts, and we are still scared for the loss of learning for those children, and the fact that they may not all of them return to school. And one of my concerns right now is more like that the inclusion is kind of the blind spot of many education mainstream response. So for example, in accelerated learning, not much is inclusive yet. So I really, as we are all trying to build back better, I really hope that this time we won't leave the children with disability behind. Thank you very much. We've shared a lot of resources that we've created during this last complicated year and a half, and it will be at the end of the PowerPoint. Thank you.
Thank you so much, Sandrine. That was wonderful. I particularly enjoyed the fact that you shared those key resources and that helped you and your team as you work. We will be sure to share those links afterwards. Charlotte, if you could go a few slides forward. These are Sandrine's amazing resources. And I think 2 more. Yeah, they're perfect. So now we are going to hear back one. Ooh, you can go back a few to where it says education. Perfect. Thank you. So now we're going to hear from Valid Subi, an education program coordinator from Save the Children International. Valid is currently finishing his master's degree in school psychology and counseling. He has more than 15 years experience working for international and local NGOs promoting human rights for persons with disabilities, as well as other marginalized groups. For 8 years now, Valid has managed the education portfolio within Save the Children International country office in Kosovo, a big part of which aims at realizing the right to education of the most deprived children, including children with disabilities and children from ethnic minorities in Kosovo. Valid contributes actively to program development and institutional memory and to experience sharing by reporting and feedback, innovating initiatives and networking with others in the country and in the region. Valid, thank you so much for your time, and we're excited to hear your presentation.
Thank you, Yasmina, and hello, everyone. So I will briefly present the work that we as Save the Children in Kosovo have done in responding to the COVID-19 crisis with a special focus on supporting the education of children with disabilities. Next slide, please. So this is Sarah. She's a 10-year-old girl living in a small village in Kosovo, which, for those that don't know, is a country located in Southeast Europe. Just like Sarah, Save the Children has supported many children with disabilities to go to mainstream and regular education through various interventions, including capacity building of teachers, introducing tools and instruments, and so on. In Kosovo, it is estimated, even though that we lack official data on the exact number of children with disabilities, but it is estimated that around 43,000 children with disabilities are in the school age in Kosovo. And just like Sarah, most or all of those children, since March 2020, when with the outbreak of COVID-19, have suffered school closure consequences. The difficulties that children with disabilities, but also other children, have suffered with the school closure include changing in daily routines. We all know that I mean, the benefits of going to school, especially for children with disability, is not only learning but also socializing and creating a routine that keeps them motivating and keeps them improving, and also include the lack of contact with other children. So this is a very also a very important aspect of going to school. Difficulties in carrying out tasks. We know that children with disabilities do require some specialized support in school, be it having an inclusive teacher, support teacher, or assistant, and so on, so that they can learn together with their peers. So for them being at home meant that they are having difficulties in carrying out various tasks. Many of them lacked technology and internet access, and also were overloaded with tasks. And most importantly, even though that other children continued to learn through various platforms like Zoom or Google Classroom and so on, in many cases, children with disabilities were not included in those online lessons. Next slide, please. So what we did, just after the school closure, the Ministry of Education started to record TV lessons and broadcasting those lessons for primary school children in the national television, and also through a YouTube channel. Those lessons weren't inclusive for children with disabilities because they weren't accessible for example, for deaf children. They weren't simplified enough for children that have learning difficulties or intellectual disabilities. So what we did as Save the Children, we approached the Ministry of Education and asked if we can do something together so that we can provide learning activities and education for children with disabilities. So what we came up of doing is to start and develop a distance learning website where we have posted various learning activities for children with disabilities, divided into activities for curriculum areas and activities area. Curriculum areas activities were those activities that were developed and provided for children that were learning through the official curriculum and through individualized education plan, while the activity areas were for those children that have more severe disabilities. In this platform, we also have provided supporting materials for teachers and parents, and also information regarding the COVID-19. The distance learning platform was built to be disability inclusive. So all the activities that have been developed and posted there were developed in close cooperation with support teachers that were working with children with disabilities, and also other professionals working in resource centers. Another very important aspect to mention is that we have also worked very closely with members of the representative organizations of persons with disabilities, and they have been a great asset to this process. Next slide, please. So as we all know, and we also have mentioned that many children need materials and resources to be able to implement learning activities while at home. So in cooperation with the Ministry of Education and education directorates in local level, we have identified who are the families and children with disabilities in need for various didactic materials, including toys, educational toys, and other materials, and also who are the families and children that that do not have, let's say, a PC or a tablet that can access distance learning platforms. So as much as we have been able to provide, we have provided educational kits to children with disabilities. Also, we have provided electronic tablets and paid internet subscription for those families that were in need for those. Can you go to the next slide? By the beginning of the school year in September last year, we have, and when the schools started to gradually open, we thought that it is very important that we, together with local representative organizations of persons with disabilities and also the Ministry of Education, develop and carry out a disability inclusive awareness campaign on safe return to school. So what we did was, together with OPDs, Organization of Persons with Disabilities, we have created an animated video for which we have also contacted children with disabilities. What do they think? How do they find it? And is it understandable for them? So the video is a short animated video that has a voiceover, also closed captioning and sign language interpretation, where we are providing information of how, what are the measures that we need to take in order for us to be safe when we return to school. The campaign also included a poster that we have developed and distributed in primary schools throughout the country, and also brochures or leaflets for children and parents. Those brochures have been also printed in Braille and disseminated with the support of the Kosovo Association of the Blind to families and children that have children with visual impairments. Next slide, please. Besides those, there were other intervention and services that we have also provided, namely in partnership with local representative organizations of persons with disabilities. Main ones include training of teachers and parents, so teachers that have children with disabilities in their classes, and parents or caregivers of children with disabilities in digital competencies. So we wanted to train them on how to use the distance learning platform, including the one that we have developed with the Ministry of Education, but also other platforms like Zoom and Google Meet and so on. We have provided virtual regular meetings with parents, so with our local OPD with whom we partner. We have been providing a lot of services and meetings for parents and children with disabilities. So we try to continue those activities, but in a different way. Provided online services and recommendations for parents on actions to be taken with their children, especially on ergotherapy, developmental therapy, and speech therapy. Provided online group session for parents on positive discipline, and this is very important when it comes to mental health and psychosocial support, about stress management and also self-control, and also created some video tutorials on how to adopt some home tools to be used as didactic tools or didactic materials. Next slide, please. So these are the main challenges that we have identified for both children and parents during this period. So as I said, among the challenges that children were facing is the change in their daily routines. They were prohibited of regular activities because they weren't going to school. So of course, lack of socialization, lack of emotional support, changes in learning formats, which for children with disabilities is very, very challenging, and also interrupted access to other services, including rehabilitation services and recreational activities and so on. Among the challenges that parents have been facing include lack of competence to support children with lessons. So as we know, supporting children, the education of children with disabilities needs to have some expertise, and some parents didn't have that. The digital illiteracy, stressed out, overloaded around children. They were also reporting that they feared the lack of services will lead to regression in their children's progress, and also lack of services and isolation at home has impacted parental stressing practices. Sorry if I took longer than 7 minutes.
No, thank you so much,
Thank you for
Walid.
attention.
Thank you. Thank you for your presentation. I enjoyed hearing about your experiences and the in-depth way that you implemented your distance learning. Also, thank you so much for all the participants who are putting your questions in the chat box and in the Q&A. We will try to address those as we round out the presentation. So lastly, we are going to hear from Melissa Diamond, who is another inclusive education task team member and is the executive director of a global voice for autism. Melissa has over 11 years experience in disability inclusion and refugee support. And since founding a global voice for autism in 2012, she has scaled the organization to support over 16,000 parents, teachers, and children with developmental disabilities worldwide. Melissa's work is focused on supporting the success and inclusion of those living at the intersection of displacement and developmental disability, and she has spoken about this issue on numerous global stages, including the United Nations for World Autism Day. Unfortunately, Melissa could not join us live because she had another professional commitment at this time, but we are happy to share a recording of her presentation as well as her contact information in case you have any questions for her about her work. So Charlotte, if you could put the video, that would be great.
Hi everyone, my name is Melissa Diamond and I'm the founder and executive director of A Global Voice for Autism. A Global Voice for Autism equips refugee and conflict-affected communities to support and include children with autism and developmental disabilities in their classrooms, homes, and communities. We offer programming around the world, including hybrid in-person and virtual programming in Jordan, the Palestinian territories, in Turkey and Greece with refugee populations, in Algeria, as well as in the United States, with the Somali population in Minneapolis and the Syrian population in Des Moines. We also have virtual programs in the Palestinian territories, Iraq, Pakistan, Lebanon, and Turkey. Our programs include parent and teacher inclusive education training cooperatives, parent, teachers, and siblings support and self-development groups, community education and inclusion events, inclusive community playgroups, advocacy training, virtual support consulting, a global community network, as well as our Include 2020 COVID-19 emergency response and mobile application. The COVID-19 pandemic disproportionately impacted individuals with disabilities and their families. It also disproportionately impacted refugee populations and populations whose lives are affected by conflict, which are many of those who we serve. Within the Global Voice for Autism network, a survey revealed that 41% of the individuals we served were experiencing food insecurity. 39% had experienced domestic violence in the first 6 months of the pandemic, compared to 19% pre-pandemic. And 21% had either had or were at risk of having their electricity cut off. Furthermore, 75% of the teachers in our networks who promote and train families and inclusive practices in their communities lost their jobs, as many of them were employed by private schools or nonprofit organizations that did not turn to virtual schooling or other options during the pandemic. Furthermore, 43% of children were reported to display new aggressive and self-injurious behaviors during the quarantine and the pandemic. And despite all of these challenges, 30% of parents said that educational support for their children was a top need, and 100% identified this within their top 3 needs during the COVID-19 pandemic. This is why we launched the Include 2020 program. Include 2020 provided in-kind support to families experiencing food insecurity in the form of food and grocery store gift cards. We also partnered with a therapist in Jordan to provide culturally competent services to those families in need of mental health support. We increased our virtual consulting capacity to support additional families. And then we also launched the Include 2020 mobile application, which was able to employ many of those teachers who were out of work due to the pandemic, who had been trained in inclusive education, to produce content that trains parents and caregivers in evidence-based practices for developmental disability support during the pandemic and beyond. Here you can see some of the mobile application. It is currently down from the App Store and getting an update, but should be back soon. And you can see that families can work on foundational skills, academic skills, skills for independence, or enrichment activities through the application, and then can apply these skills with their children at home so that they have some guidance as they're working to teach their children, whether during virtual learning or just in day-to-day life. We've seen a number of promising results from these programs, including decreased parenting stress levels and increased parent confidence, as well as 96% of parents who go through our programs and then remain involved in our Global Voice network, connecting with other families, providing advice and support, and training other members of their community. We've also seen that children with developmental disabilities who go through our programs experience increased school readiness, improved performance on numerous child development metrics, as well as increased rates of admission to public schools, both because of their skills development, as well as because of the advocacy that their teachers and families are doing in order to increase inclusion. For our teachers, we've seen an increased perception that inclusive education adds value to all learners, as well as reported increased implementation of these inclusive practices that we teach in their classrooms. 93% of the teachers who have gone through our programs have gone on to advocate for their schools and classrooms post-training. And 82% remain involved in the Global Voice network, guiding other families, asking questions, and participating in a mutual support community. Siblings have also reported improved relationships with their siblings with disabilities through our sibling support group, increased self-confidence. We also noted that 92% of siblings in the program met another child with a sibling with autism for the first time through the program, and 98% would recommend the program to other siblings. For community members, we were able to correct misconceptions about autism and disability, the most frequent of which is that children with developmental disabilities, particularly autism, can't learn. As well as we saw an increased desire to include people with developmental disabilities in their classrooms and communities, as well as an increased desire to engage in advocacy. Unfortunately, I can't be there with you live today, but I encourage you to please reach out either through our website, Facebook, Instagram, Twitter, or you can email me directly, and I'm happy to answer any questions. We would love to learn more about your work as well and to explore possible partnerships. Thank you.
Thank you so much for sharing that video, Charlotte, and thank you to all of our panelists. This has been such an interesting time to learn from you all about your experiences and your work. Now we are going to shift into the discussion portion of the webinar, in which I will ask our panelists a few questions about their work, including the questions you all have posed thus far. And as we ask these questions to each other here on the webinar side, please feel free to put in your answers in the chat to all of our participants. We also, of course, would love to learn and to hear from you. So a first question that we have, which I was also going to ask, is regarding technology. The question is, the digital divide, which is a huge barrier for children in accessing learning materials, how would you and your different organizations address these challenges? Especially since I think you both mentioned interventions that did use technology.
maybe I can start if you want, and Valid, you can complete. So no, it's been an issue for us as well, and that's why in the presentation, if you remember, we also have used a non-technological response in some area. I think a lot has been done, so it's always you know, it's also an opportunity because a lot of people have invested and a lot of companies have also made progress. So we're really focused on the local, solid, and mostly offline technology. There's some very performant routers as well right now. So really, we use what we could access, trying to enhance, and also with humanity and inclusion, we always work with the government. So definitely there's always a part of advocacy to the government if they develop some kind of technological response to ensure it is accessible. So my answer, Valid.
Yeah, I mean, likewise, what we really hope for now is that we could start at the very start together with the Ministry of Education and make those TV lessons disability inclusive and accessible. When we developed the distance learning platform, and when we found out that, you know, there are a lot of families and children that do not have access to, I mean, technology and internet, then we continued investing in the platform as a tool for, you know, coordinating teachers and parents and so on, so that teachers can get activities from there and via phone calls and so on, communicate with parents and explain to them how they should or can implement various activities. We also have some kind of options where the learning activities can be shared via WhatsApp or through other channels. So that is a way. And also the kits that we have provided, we think that it helped a lot those children, and the e-tablets as well helped a lot those families that did not have access. And unfortunately, I understand that the distance learning platform wasn't the best solution to reach all the children, but it was something that we wanted to start and support the education of children with disabilities when the schools were closed.
Great. Thank you both so much for your responses. Kind of related to that question, we have a question that just came in asking about if you see any positive moves taken because of the COVID situation and distance learning when it comes to involving families and the whole communities in these projects. And I think this is a great question because in my conversations with Melissa prior to this webinar, she even mentioned that using distance learning has actually brought people into her programming that she couldn't have brought in prior. So did you all have any experiences like that? And how do you notice distance learning affecting that space?
Yeah, I mean, if I may, sorry. So that's the point. Among the children, the 43,000 children I mentioned, nearly 15% are going to school in the country I live in. So through the learning platforms, we have been able to reach more children than when the schools were opened. So it is something that we are planning together with the Ministry of Education, that we continue investing and developing the platform even beyond the context with COVID-19, and use it as the main online resource center for the country when it comes to inclusive education of children with disabilities.
Yeah, just on my side to add, I think for us, we've been advocating for a long time for technology, because it's a great opportunity for children with disabilities to access some material. Once you have just even a book, like a Braille book, is very heavy and difficult to transport. So if you can have an access to technology, obviously it's fantastic. I think it's the crisis has brought some attention to it. So we were advocating, but nobody was listening. Right now, I think everybody understood that there is a need and this needs to be there. And I think for me also, for the teacher, it's a great opportunity to exchange learning resource and to have access to more resources. So definitely for children and parents, but also for teachers. Though like Valit said and many others, there's a huge need for the digital capacity building of parents and community and teachers.
Yes, wow, the questions are flooding in. We really appreciate it, everybody. We will try to address as many as we can. As I'm looking through these questions, I'm seeing that a lot of them relate. So another question that somebody asked was wanting to know about the key results observed so far with these interventions. And that made me think about the difficulty that might come with monitoring and evaluating distance learning and different programs like that. So if you could speak to your experience about key results and how you have gone about monitoring and evaluating, that would be really interesting as well.
That is, I think, a great question, and that is one of the biggest challenges that we're having, because at least in Kosovo, not only learning education of children with disabilities and the interventions that we as Save the Children are provided, but also the distance learning in country level lack a proper assessment. So we do not have any data or any monitoring of how well children are doing in distance during this school year. So that is something that we need to work on and find a way forward.
Yeah, I agree. This is really a weak point, I guess. It's been really difficult, just also in terms of access in many areas. It's been difficult to just access and have activities over there because of the restriction. What we already know is that it definitely didn't concern everybody, and we're fully aware that we couldn't reach out to every children, and that still many children didn't access this remote learning. This is in the report we mentioned earlier from Save the Children. I think also in some of our countries, schools are still closed, so it's difficult to assess the learning outcome from such a specific year and difficult one. So, and also in some cases, at least for us, especially for children with heavier disability, we had other priorities. We were really concerned by their safety, their access to food, all the issues, because they were lacking all other services like rehabilitation, speech therapy, most of them stopped. So I think we really focused on the well-being, make sure they were fine and that we were still connecting and hopefully learning. But I guess we'll definitely learn more this year.
Thank you both. That's great. And I also shared in the chat a link to INEE's technical note on measurement during the COVID-19 pandemic that might be helpful for participants as well if you wanted to hear more about that process. So we also have a lot of interesting questions around coordination and around using these success stories and lessons learned to leverage this to support policy dialogue in your countries as well. I know, Valid, you mentioned that, are you an education cluster co-lead? So if you could all speak to your experiences with coordination around this work and how you then take that and advocate to the government.
I mean, in Kosovo, we work in partnership with various stakeholders, most importantly with organizations of persons with disabilities and other partners that we implement several interventions. So I think that the role of the ministry has been crucial in kind of coordinating interventions in country, in bringing us together and coordinating us, because for example, there's another platform that we have supported in partnership with UNICEF that has to do with early childhood education. That's something similar to the platform I have presented. So these kind of interventions and coordinations that have been carried out and led by the ministry. And we are trying to document all the models and success stories that we are having, and using them for our advocacy efforts in country level.
Yeah, I think more or less the same. Maybe I'll make a difference between the advocacy at higher level, where we've been really advocating to donors and to technology companies, but then like really to understand that the technology doesn't equal accessibility. I think IDEA, International Disability Association, has been trying to do a lot of advocacy on that. And we also have been trying with the donor at national level. There, I think it's more difficult somehow, because this is emergency, this needs to go quickly, and there are so many needs that I find it actually really difficult to advocate for inclusion. We're saying, oh, okay, this is really interesting. There's so many other problems like we need to answer globally. So I find it still hard to advocate during this time on this. And I think also one issue I find in humanitarian action is really the lack of data. This is something that comes back very often when we talk about children with disability. But obviously, if you don't collect the data, you don't see the needs. So right now, it's again a blind spot.
Yeah, it was interesting to see all the data that, for example, Melissa was able to collect about the people who she was working with. And if we could get that kind of data on a large scale, I think that would in many ways change what we're doing and inform us in a more meaningful way. We just had a great question that kind of is speaking to the sustainability of using websites and apps and different ways that we try to reach large audiences. And the question is, what do you think, instead of something that might be more temporary, what do you think is a lifelong way to respond to students' specific needs in emergency situations? And I think in my head, I'm thinking a lot about this advocacy, but what are other ways, do you think?
The best way, I think, is to make the entire program disability inclusive since the beginning, and that includes involving and having a disability inclusive lens when we design our programs, and especially when we budget. So apart from I mean, what would be something that might work? I said, for example, it would be like TV lessons would be something that, in case of emergencies, when we do not have access to schools, can be a solution. Other things, I don't know when, because the context with COVID-19 was something that was prohibiting the direct contact with teachers and so on. So these are the things that I think might be more sustainable.
Yeah, they are. I mean, we're saying it very often that if it's accessible to children with disabilities, it's going to be accessible to maybe not all, but most of the children. So it's always a clever choice to do that from the beginning, embedded into the design. So because it's cheaper than if you have to do add-on. And I'm thinking again about this example that I presented from Kenya. I think it's really also a nice example of the nexus, because all this material, the fact that all the curriculum has been digitalized, obviously useful for us in Kakuma and Dadaab, but this is really something that now belongs to the government, and that's available everywhere in Kenya. So available for all.
Great, thanks so much. I kind of want to shift our questions more to the teacher and student level of the relationships that you or maybe the members of your team build. And so one great question we had was, where teachers have been resistant to including children with disabilities in their class or in their work, what practical strategies have you or your team found that help them to become more positive and confident with the work that they're doing?
So I think for us, it always starts with awareness raising and training. We say it often that it's first and foremost an issue of attitude. We have situations where people have absolutely no resource, and I've seen it in Afghanistan. I've seen 2 blind children following the class with other and writing on their small boards. So they just learn manually how to write in Arabic. And it was before our intervention, so we really had no part into it, but just they were welcomed by their community and accepted the way they are, and those children were learning. So I think really most of the time teachers are just scared, afraid, don't always know what it is. Many people are always afraid that it's contagious, they're gonna get it, it's gonna lower the level. So I think when we start with that, a lot more is possible. The training, and I think really, like Valid mentioned, a lot of time it's really useful to work with the organization of person with disability or individual if they're not organized, because they're an amazing resource that you can tap on. Another amazing resource that people are not using enough in the school, I guess, are the other children. You know, children are always very happy to help their friend, and it's really good for them because there's no better way to learn than to teach. So.
Yeah, I mean, just to add, I mean, we need to have a holistic approach when we want to promote inclusive education for children with disabilities. It doesn't. It's not enough if we work only with teachers, but also we have to work with the community, and also we have to work in the policy level and so on. So what we have worked include training of teachers on, attitudinal trainings provided to teachers, and explaining to them explaining to them about the right to education, and about the disability and how they can support children with disabilities in their classes, and at the same time implemented awareness raising campaigns for the general public, providing information sessions, using role models. We have success stories among persons with disabilities in country that we have collaborated with in those awareness raising campaigns and so on.
Great, that's wonderful, because we also do have a lot of questions coming in about the larger community and families and even peer-to-peer support. So it's great to hear that you all do imagine and also experience this like holistic approach in which you're not just working with the teacher or the student themselves, but building that community around them, which is very important. So with the last few minutes that we have left, we are going to turn away from the participant questions, which have been wonderful. Thank you all participants for the questions you've been asking. We will try to answer them separately and send them out with the recording of the webinar. But just to leave our participants on an actionable way, or with information for how they can move forward, if you could think of like 3 things that overnight an organization could do to make their work more inclusive, or maybe 1 to 3 things, what would you recommend for people as they go on with their daily work and trying to become more inclusive?
I'll try 3. I think I would probably just start with the data. If you have the data, or if you inquire about the data to the cluster, you will find out that there are actually children with disability out there. And therefore you can plan for something. Also, there's many quick wins that you can start with. We mentioned attitude, but the welcoming, the being part of the community, for me is essential. Of course, there's the academic learning, but school is also about more than that. So I think welcoming the children and looking for resources that are out there. There are resources. We mentioned the children. There are potential members of the family that can support. Definitely person with disability, organized, organization of person with disability are out there. or specialized NGO, they will be really happy to support. So just don't fear. Each time you try, it works out fine. So I think just go for what you feel you can do, and move on later with more difficult topics.
Thank you. Valit, do you have any additional advice?
Okay. Well, what we have learned throughout our work is that we need to include persons with disabilities, be it organizations of persons with disabilities or individuals, at the every stage of the project life cycle. So when we design a project, when we kind of implement it, when we monitor it, it's crucial to have persons with disabilities involved in the process and having their insights. Another very important aspect is to the budget. I mean, it is very important for us to make sure that we have a budget for accommodating persons with disabilities needs in our activities, in our events. We have budget for sign language interpretation. We have budget for braille printing. We have budget to organize an activity, let's say, in a place that is appropriate and accessible for persons with disabilities and so on. So these are the things that I would recommend in making our program disability inclusive.
Great. Thank you both so much. And thank you so much to the participants. The comments in the chat have been wonderful. Your insights are really valuable to us and everybody else who's here. So thank you so much for everybody who has joined us on our call today, for our panelists taking time out of their work, out of their day to share their work and experience with us. And also many thanks to the INEE staff who has supported us through this webinar planning process and in all that we do. Please do keep in touch with us. We are the Inclusive Education Task Team, and we plan to be around for a while and be on the lookout for future opportunities to engage. Again, thank you all so much, and I hope you have a great rest of your day.
Thank you very much. Bye.
Bye. Thank you.